Hi and welcome back to my channel. I recognize the lighting is not the best, but I wasn't really planning on filming anything. I just had a question come up in one of my intakes, and it's a kind of a common question that comes up in my intake, so I thought I could just quickly make a video on this. I'm also allowing my dog to sit with me, which hopefully he is able to control himself and be good and behaved, and if not, he's gonna have to get down. Right, Ben? You're gonna behave? We shall see. So anyways, the question that comes up in therapy is, can a therapist prescribe medication? Now, I'm only going to speak from the state of California because that's where I'm licensed in. When you become a licensed therapist, you are not automatically licensed in every state in the United States. You can only operate in the states that you're licensed in, so I'm licensed in the state of California. In the state of California, there's a big difference between a therapist and a psychiatrist. A therapist, for context, has their master's degree. Hold on. A licensed therapist has their master's degree. After they graduate with their master's, they have to do a certain amount of hours under a licensed therapist, and they're overseen. It's like being an apprentice or having like an internship. And then once you've completed all your hours, you can take a test to become a licensed therapist. Once you are licensed, you can conduct therapy on your own. You can have your own private practice, things like that. And by the way, I'm a licensed clinical social worker. There's also licensed marriage and family therapists, which are kind of the same, but a little bit different. And then there are, I think, like some type of licensed counselors, but I'm not really sure. I bring that up to say I'm talking about a licensed clinical social worker in the state of California. So basically, when we're in school, we learn a little bit about medications, because you should have an idea if a client in an intake says, I am prescribed Prozac, you should know that they're being treated for depression. However, we don't study medications and how they affect the brain and the body and all of that. We're not doctors. So the difference is, if you would like to be prescribed an antidepressant, something to help with anxiety, an antipsychotic, you would need to see either your primary care doctor or a psychiatrist. A psychiatrist studies medication. There are some psychiatrists who do therapy and medication management all in one. So they'll be your therapist and they'll be your prescriber. There are some psychiatrists who only do prescriptions and they don't do therapy. So they'll sit with you. You might have a 15-20 minute appointment, you tell them your symptoms, they prescribe you a medication for it. In therapy, it's all therapeutic, and a therapist is not going to prescribe medications, at least in California. So what I find is a lot of people do a combination of both. They will come to therapy, they'll work with me, and then they'll also be working with a psychiatrist. So they'll have their medication management to help with the anxiety or the depression or schizophrenia or whatever. And then they will be working it out with me, talking, we'll work on coping skills, processing thoughts and feelings, trying to control behaviors, regulate emotions. We do all of that work together with the combination of the medication management. As far as whether or not you need meds, I have sometimes people ask me, what's your opinion on medication? I don't necessarily think it's appropriate for me to tell people my opinion on it, because I don't want to sway somebody one way or the other. You really have to do what you're comfortable with. I completely understand when people say that they do not want to be on medications. The reason why somebody might not want to be on medication, it could just be a personal preference. It could be, some people will tell me I'm afraid of, or I have a fear of addiction. Addiction runs in my family. I don't want to be on medication. Some people tell me that it's a faith-based decision and what they're comfortable with. Honestly, it's really up to you. And then I have some people who are like, look, this anxiety or this depression, it's so unmanageable that even if you tell me all of the coping skills, I don't feel like I have the capacity to use them, because I am so heightened in my symptoms that therapy doesn't even run through my mind. I need something to regulate me, and then I can implement those coping skills. And I understand that perspective too. I don't think that there's a right or wrong as far as whether you should take medications or whether you should not. I think it's a personal preference. It depends on a lot of things. It depends on what you're going through. It depends on what the symptoms are like. It depends how severe they are. It depends if it's something that is curable or not curable. I say all that to say there are a lot of things that go into that decision. I am not personally going to tell you whether you should do it or you shouldn't. I think that it's a conversation that you should have with your primary care doctor or your psychiatrist. You can also ask your therapist just information in general, but they won't be able to prescribe to you, at least in the state of California. I hope that is helpful. My best advice is, if you have any question about whether or not you want to see a psychiatrist, I say book a consultation. Just because you book a consultation with a psychiatrist does not mean that you have to agree to taking medications. but there's nothing wrong with gathering information and then making a decision based off of what you've gathered. So if you feel like, I'm not really sure if therapy is for me or psychiatry is for me, I'm not really sure if just talking about it is going to help, or I'm not really sure if the medication is going to help, I think schedule a consultation with a therapist, see what they have to say, see what methods they use, see if you feel comfortable. Also schedule a consultation with a psychiatrist, see what they have to say. You guys can talk about side effects. You could talk about how it helps, how it might not help, what the risks are, all of that. And then once you know that information, you'll make a better informed decision because you have everything that you need to have. I hope that's helpful. It's a really short video. Ben, you're gonna say bye? Say bye. And we'll see you in the next one.